several useful tips to keep in mind during an independent medical exam that may influence in a positive manner the outcome of the independent medical exam results. Number one, be honest. In other words, do not exaggerate your injuries. If something causes you pain, of course, let the independent medical examiner know. But if you are expressing unreasonable amounts of pain, it will damage your credibility. Number two, be courteous, but also keep in mind that the independent medical examiner is not there to support your case or be your friend. Number three, do not be afraid to admit if a treatment has helped, because it will in fact support your credibility rather than trying to argue that nothing has helped in the past. Give an accurate description of how your injury took place. Any inconsistencies between the current description and the way that you've described how you were injured in the past can damage your credibility. Explain to the doctor that your ultimate goal is to get better, return to work, and try to live a pain-free life. Telling the doctor that your ultimate goal to get a pension will not get you a pension. The Department of Labor and Industries or self-insured employers must follow strict legal requirements if they want to order an injured worker to attend an independent medical exam. Number one, the notice to the injured worker must be in writing and it must be received more than 14 days before the exam is supposed to take place. Moreover, the notice to the injured worker must identify the purpose of the exam. If the notice does not include the purpose of the exam, the injured worker is under no legal obligation to attend the examination. Recent legislation now allows the injured worker to record, either through audio or video, the examination conducted by an independent medical examiner. It's recommended for the injured worker to have accompany them to the exam, either a friend or a family member, to do the recording. One common pitfall of an independent medical exam are what they call Waddell's tests. Waddell's tests are designed to identify malingerers or fakers in independent medical exams. An example of a Waddell test is called a simulation test, and that's where a doctor will place his hand or her hand on top of the injured worker's head, pressing down, and ask if that increases low back pain. Anatomically, it should not. But many injured workers who felt that they have not been heard relative to their injuries will express increased pain, and of course, that makes it look like they're faking or malingering their industrial injury. So these types of tests are commonly completed by independent medical examiners, and it's strongly recommended to talk to an attorney because the tests are too many to list here.